Today we are all poor. Of what value is it to live in a country where the richest get to be healthy and the poor gets to work for the richest to make them healthy and not getting a proper healthcare in return? Change is needed now more than ever. I would love to not having to speak about this subject, as it should not be a needed speech in year 2015. However, something has got to be fixed. We cannot allow such a big spread in income that unfortunately also is the greatest determinant of a person's health. Today I'm going to speak about the fact that we've got an income control health system in the United Kingdom, along with telling you about an email I received the other day from a person which her son is really in need of healthcare, but she cannot afford the surgery needed for her son. Not so long time ago, a new publication about life expectancy was published, and this publication revealed the population living longer, healthier, and according to some, happier lives. This sounds very interesting, right? No, not if you dig deeper. This publication also revealed a persistent and alarming gap in life expectancy between those at the top and the bottom of society. There is no doubt about we have experienced improved overall health, though analyses made by the Equality Trust has also found that in the last 20 years alone, the gap in life expectancy for those in different local authority areas has increased 41% for men and staggering 73% for women. Since the early 1980s, economic inequality in the United Kingdom has grown tremendously, and now the richest 10% of households own 40% of all wealth in the United Kingdom. This is a stunning 850 times the wealth of the bottom 10%. Most developed countries enjoy about the same rate of improvement in life expectancy regardless of their rates of economic growth. When inequality increases, improvement in life expectancy regardless are a little slower, and when it decreases, they are a little faster. Health inequality also shows a number of specific challenges for policymakers. How can a government possibly calculate a fair and reasonable retirement age when there's such a wild fluctuation in life expectancy in different areas? Researchers also show that economic inequality is not only a health issue. More unequal societies are more likely to experience poor literacy rates, higher incidence of drug addiction, greater levels of violence, and a multitude of other social ills. The other day I received an email from a worried and upset parent. This parent lived in one of the more poor neighborhoods in London. She wrote me to ask for help and tips on how to get her son treatment for his illness. I feel so bad for not being able to give her better advice than I did. She had been looking for a kidney donor for her son constantly in 2 years, and now her son's illness has worsened, and she was more desperate now than ever. The only piece of advice I was able to give her was that she was to take the story to the media and hope that it would increase the lack of focus on health inequality. We cannot accept such a big difference in life expectancy between rich and poor. Personally, I think it is the biggest abuse against human rights in developed countries. I don't know about you, but I would definitely like to see some changes. But how can we change this pattern of more and more inequality in our society? The key is to deal with the underlying issues of economic inequality. For an example, income inequality, relative poverty, unemployment, underemployment, insecure and volatile incomes, and the low-pay economy many are now stuck in. These are factors that all have a negative impact on people's health. A country that allows its poor citizens to die 25 years earlier than its richest is one that is likely to suffer from a worrying breakdown in the social fabric that binds society. Inequality is not only a threat to our health, but a threat to our entire country. Thank you all for listening. Do you have any questions?